Nisha the PA, we're alive.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today we are doing Fractora. Now you guys have heard me talk about this before. It's one of my favorite treatments for treating not only acne scarring, but it also helps to address a lot of textural concerns that my patients may have, whether it's fine lines and wrinkles, whether it's scarring from some type of accident. This is really a great treatment to do on a regular basis. Now, there's a couple of different reasons why I love Fractora, and just so you guys can see a little bit more about the device, this is microneedling with radio frequency, so you can see my little needles, and on the end of those little needles, we are delivering radio frequency energy. It's a combination of both microneedling and with radio frequency that's really going to help to retexturize his acne scarring. Now, a little bit about my patient. He has been suffering from acne scarring for a while, and he really wanted to start taking care of his skin. He was really committed to really being on a really good treatment plan and doing all of our recommendations. Now, this is about treatment 6 for him, but you can see that his acne scarring has improved. You may see a little bit of texture here. We just got done doing TCA cross, which is why you can see a little bit of frosting to some of his pores on the other side as well. So these are just a little bit of frosting from the TCA cross. Remember, TCA cross is going to help to also resurface some of those acne scarring, some of the enlarged pores that he have on his face. And now we're doing Fractora, which he's been very consistent in doing. Today you may say, well, Nisha, his skin looks really, really good. I don't see what you're talking about. And that's because he's been doing treatments for the past few months. He's been very diligent doing that along with skincare.
Nisha, can we use this technology on other parts of the body like the buttocks and back?
Now, really, it depends on exactly what we're treating. If we are treating a scar, right? Maybe you have an old scar to your buttocks or your back, then yes, you can use Fractora. But I really have to kind of assess and take a look exactly at what you're referring to see if this is the best treatment for that. But yes, Fractora is really, really great for texture. So, a couple of different questions my patients ask me. Number one, how many treatments am I going to need? I always recommend you start off anywhere between 4 to 6 treatments of Fractora. You do need a combination of treatments. You need consistent treatments every 4 to 6 weeks. How does Fractora feel? Well, it's a little bit spicy. I'm going to be very, very honest with you guys. We do 30 minutes of numbing beforehand. That makes the procedure a little bit more tolerable. And if you're super sensitive to pain, then of course we can do nerve blocks, which will help to numb a big part of your treatment area and make the procedure really, really comfortable. So this is a little bit uncomfortable. He's doing amazing. He's always done amazing. You'll see a little bit of pinpoint bleeding after your treatment. It's completely normal. It's almost really minimal downtime. This is the treated area. You can see tiny bit of pinpoint bleeding, but not too much. So treated versus untreated, because a lot of my patients want to know what's the downtime associated with Fractora. I tell my patients honestly maybe a day or so, a little bit of pinpoint bleeding. As you can see, the pinpoint bleeding has already started to go away. And now we're going to treat the chin.
Is this a permanent treatment?
So permanent treatment as far as results, yes, but you have to let the results build on itself, which means you're not going to notice, you're going to notice a little bit of improvement after each treatment, but you have to continue to do treatments to really get the full effect. Now, another great reason why I love Fractora, not only is it like microneedling on steroids. Remember, you can do microneedling, but this is a tiny bit better because of that radio frequency. But you can also build your treatments and combine it with other treatments to really give you kind of the biggest effect possible. Now today, as I've told you, we've already done TCA cross. Now we're doing Fractora. Next, we're going to do Clear and Brilliant. And it's that combination of treatment for my gorgeous patient that has really been working for him. So we're going to continue to do this treatment.
What percentage of improvement is expected after each treatment?
That's going to differ from patient to patient, but expect at least 15 to 20% improvement after each treatment. And look at that. He looks amazing. I'm going to have to post his before and after photos so far. He's been extremely happy. Matter of fact, I'm going to tell you a little story. My patient has told me that he's to the point where he's extremely happy with his skin. He used to be a little bit more self-conscious about his acne scarring. And even now, even though we're in the midst of treatment, we're not completely done with his treatment plan, he's very, very happy with the outcome so far. So happy that he's like, I don't have any fear going out right now with my skin. I'll let you do. I mean, he's right here. He's awake, guys.
It's very true. Like, just even like, you know, looking in the mirror or just going out and meeting friends and new people. The last thing I have to think about is just like how I'm gonna look like, or am I breaking out, or is my skin gonna look like this?
He's flawless. That is what we do it for. He's very happy. I'm extremely happy for him. I love when my patients, their self-confidence improve because they're doing kind of the groundwork to help get their skin where it needs to be. And so even though we're not done with this treatment, remember your skin is a lifelong thing. You always have to take care of it. He is on the path. He's already there to looking and feeling more amazing than what he already is.
Nisha, what is our aftercare like at home for this?
Now, of course, aftercare. As I mentioned before, you have a little pinpoint bleeding. There are some products that I recommend you do in combination with your Fractora treatment, which will help you heal a lot quicker. Number one, I'm going to recommend a product called Skinzyme. It's a really great product, like a green mask. And you put that on the next day, leave it on for 20 minutes, let it dry. And what that's going to do is help to gently exfoliate as your body starts to heal and resurface some of these little microneedling holes that I'm creating. The other products that I really, really love, you guys have heard me mention it before, that's going to be your anti-age serum, which is a concentration of growth factors. It's also going to be your refit face, your concentration of peptides, and it's that combination that's going to help you heal super, super quick. Remember, you can see right now, this is the downtime. There's no bleeding on this side at all.
Someone is asking how much for facial hair removal, guys. We do a lot of laser hair removal here. We do with our Stanza, our media starting to get you and Nisha. And just to let you know, if you are willing to film with us and prepare treatments, we do have some special pricing available. So make sure you guys get in contact with us. Send us a DM, full name, email, and phone number. We'd love to treat you.
Oh my gosh, right now is the perfect time to do your laser hair removal. Why? Because it's a little bit cooler outside, so you can get all your treatments done, and you'll be just in time for the summer. And when it starts to get a little bit warmer in LA or wherever you may live, it's a perfect time to get it done, especially because of our specials we're offering right now.
Nisha, what are our hyperpigmentation risks on this?
Now, this is very low because, number one, this is he has a skin type 5. I have a skin type 6. Fractora is really safe on all skin types. You have to know what you're doing, though. We're using coated needles, which are going to help to protect his skin from hyperpigmentation. Now, remember, this is like his 6th treatment, and it's actually improving his hyperpigmentation because we're combining Fractora along with our Clear and Brilliant. And I'll show you guys a little bit more about our Clear and Brilliant and why I love it and why we're able to help improve his hyperpigmentation and not actually induce hyperpigmentation on him. Okay, perfect. So he's just about done with his Fractora. Now we're gonna move on to the Clear and Brilliant. Let me show you how easy it is to kind of switch over to our Clear and Brilliant machine. I'm gonna start off.
Do you offer laser hair removal for higher Fitzpatrick types?
Yes, we can. I've done laser hair removal on myself, guys. I'm a Fitzpatrick 6, so I'm super, super melanated. I've done it on myself, super safe, and that's the same type of treatment I do on my darker skin patients. Super safe treatment. Now, right now, we're going to move over to our Clear and Brilliant.
For those of you with laser hair removal questions, guys, make sure you send us a DM, full name, email, and phone number, or you can go jasonmrmd.com. Get your questions answered there. Get your consultation with Nisha the PA, Dr. Emer, or one of our other treatment coordinators.
I would love if you guys reach out to us. And I'm going to go ahead and give you a fan to hold on to. Everyone loves this little fan. It feels so good. Sometimes the patient puts it on me, helps me to cool down as well. Perfect. Now, Clear and Brilliant, what are you going to expect? Number one, several different reasons why I love it. Safe on all skin types, Fitzpatrick 5, my skin type Fitzpatrick 6. And we're going to do a combination of treatment which is going to help to treat not only his enlarged pores, acne, scarring, but we're also going to treat hyperpigmentation. Right now we are using the original handpiece from the Clear and Brilliant. That's one of the great things about the newer Clear and Brilliant is that I can easily switch from using the original handpiece that more so helps for enlarged pores. And then I can switch to the Premier handpiece that's more so for pigmentation. So I'm gonna have you tilt your chin down just a little bit, perfect, just like this. And then we're gonna start.
All right, for those of you saying you would really like to see Dr. Jason next summer, make sure you send us a DM, full name, email, and phone numbers. Get your consultation. Our procedures do book up relatively quickly. We will be doing some traveling, some pop-ups as well. Make sure you guys get in for those.
All right, we're gonna go ahead and start on his forehead. Now, what do you experience with the Clear and Brilliant? You experience a little bit of warmth. That's why we have the fan that's gonna help to keep our client nice and cool. And of course, that warmth adds up as we go over and do a little bit more on both of our hand pieces. But it's very gentle warm, nothing that you can't handle, I promise. So we're gonna do our first few passes with this hand piece. Remember, this is the Clear and Brilliant, the original hand piece. The great thing is that we can address both texture concerns and pigmentation. I'm gonna fix this really quick because I am fogging up.
Hey guys, make sure if you guys have some questions on Clear and Brilliant, make sure you ask us. We have Nisha the PA. We'd love to take all your questions. We have some laser treatments, microneedling questions. Pretty much any questions you guys have, we'd love to answer them for you.
So once again, we are combining treatments for my gorgeous client, which is helping him address his acne concerns. He had some acne scarring. He also had some hyperpigmentation. Remember that we want to get your acne under control, as well as take care of the problem that you already have, which typically is the acne scarring.
Nisha, did he do Cosmelon prior to the Fractora?
I asked him, did you do Cosmelon?
I
did. Cosmetic is a really great chemical peel that can help to lift a lot of the hyperpigmentation associated with acne. We can also do it if you have hyperpigmentation associated with melasma.
Like, people asking, what is the time of this laser treatment, guys? We also call this our lunchtime laser. You can even come in, get this done on your lunch break.
It's a very, very quick procedure. Oh, give me 1 second. Let me go ahead and clean
Alright guys,
this really quick.
can we laser the hairline, Nisha?
Yes, we can. So Clear and Brilliant is really, really safe over hair-bearing areas. So he doesn't have to remove his hair. Right now he has it cut short, which is great because the laser can make contact with the skin underneath. But he doesn't have to. It's not going to destroy his hair bed or anything like that. He's still going to be able to grow a full beard. Were you growing a full beard before?
Yeah.
Yeah, he's still going to be able to connect, guys. I promise. So this is a very quick treatment, guys. You can get it done over your lunch break. 30 minutes of numbing.
What is his recovery like?
30 minutes. The great thing about Clear and Brilliant is that it's very, very minimal downtime. What you may experience is a little bit of redness after your treatment.
Can you laser remove the hairline, Nisha?
If you want me to, of course.
We do laser hair removal, guys.
We can if you don't want the hair be gone, we will take care of it. So if I am working with a laser that does affect hair-bearing regions, I always ask my client what part of the hair they want and which one don't they want, and then I mark all those areas and we don't touch it.
Someone's
Not
asking.
the problem with Clear and Brilliant.
Let's see. Hey, can you please reply, guys? I'll reply to you guys. I'll make sure you reply as soon as we're done with our live. Thank you for messaging us.
Okay, perfect. Now we're gonna move over to the chin. Perfect, and tilt down just a little bit, just like that. Good. So once again, this is the original hand piece. We're moving over to his chin now. And this is going to help for enlarged pores, fine lines and wrinkles, acne, scarring. He has his fan keeping him cool. We just got done doing our TCA cross. We also did our Fractora, which is amazing at textural concerns. And this is the last part of the treatment. I recommend this combination of treatment for my particular patient. In this case, every 4 to 6 weeks, with a minimum of 4 to 6 treatments, guys.
Can we promote beard growth?
I'm not quite sure.
Guys, we can do several. Guys, we can do several steps to promote the growth of hair on the face. Dr. Emer does have several protocols on his website, and we do work with a lot of people. So, guys, if you have any questions there helping facial hair grow, go to jasonemermd.com, get a consultation. We'll make sure we take care of you. We can pretty much do anything you guys need.
PRP, You guys have heard me talk about PRP before. We combine it a lot of times. We apply it after our laser treatments because it promotes healing, the concentration of stem cells. But you can also inject PRP into areas that you want to produce or encourage hair growth. And it's like fertilizer for the hair follicle. So it stimulates hair growth in that area.
All right, Nisha, someone wants to know if they can schedule an appointment with you. They
You
feel
sure
safe.
can.
They feel safe with you because they have the same Fitzpatrick type.
Oh, I love it, love it, love it. You guys can definitely schedule an appointment.
Guys, if you guys want to get an appointment with Nisha, all you gotta do, go to the website, get a consultation. Just say that you request Nisha the PA, or you can send us a DM on Instagram too. Full name, email, and phone number. Let us know who you want to speak to, and we'll get you in with her.
I would love to speak to you guys. Now we are getting to the point where we are finishing up our original hand piece, the Clear and Brilliant. And then we're gonna move over to our Premier. You can already see how he looks. We just got done doing 3 treatments. All of these are very minimal downtime, so this is perfect if you are on the go. Minimal downtime with the Clear and Brilliant, a little bit of redness after treatment, which goes away by tomorrow. And then you may feel a little bit of a sandpaper texture, and that will go away in about 3 to 4 days. That sandpaper texture is nothing that anyone can see. It's just what you can feel as you touch your skin. But of course, you combine that with our amazing products, and it'll go away quicker.
All right, Nisha, I'm gonna let you finish up.
Alright guys, I'm going to go ahead and finish up this treatment. You guys know how to get in contact with us. You can reach out to us via DM, first name, last name, as well as your email address, and reach out to you. You guys can also follow my page at Nisha_the_PA. I would love to speak with you guys. I would love to help you. This is what I enjoy doing. Until next time, it's Nisha the PA over here at Dr. Emer's office. I'll see you guys then. Bye guys. Maybe go straight up. Perfect.